Good evening and welcome to Cafdil Healthcare. This is Cafdil Television. My name is Kojo Arthur. You would have to prevent yourself from both non-communicable disease and communicable diseases. That is exactly what we're going to talk about tonight. My guests are seated already, and I will introduce them right after the break. Stay with us.
Since time immemorial, God has always communicated himself and his will through various voices, the prophets, the kings, the judges, not forgetting John the Baptist, who was a precursor to Jesus Christ and gave us the will of God. We bring to you Voices from the Valley. This is a program designed by the Conventual Franciscan Friars in Ghana in collaboration with Cafdil TV to bring you in-depth insight in our faith, catechesis, and various Catholic teachings which will help you in your journey as a pilgrim. I know you cannot miss this program, and I highly encourage you that you shouldn't miss this program because it is Voices of God from the Valley of prayer and silence. Join us this and every Sunday at 3 p.m. and a repeat on Wednesday at 7:30 p.m. here on Cafdil TV and on our various social media platforms, YouTube, Cafdil EDU, and Facebook, Cafdil Cape Coast. Let us meet and share what God has for us through the Voices from the Valley.
Make me a means of your peace.
Welcome back. If you just join us, this is Cafdil Healthcare on Cafdil Television. We are live on Facebook and also on YouTube. Facebook is Cafdil Cape Coast and YouTube is Cafdil EDU. My guests tonight are Chandi Ephraim. He's a public health nurse at Cape Coast Teaching Hospital. Abigail Adams Sirifi, also a public health nurse, Cape Coast Teaching Hospital. And also Ifwa Asan. She is also a public health nurse from Cape Coast Teaching Hospital. Gentlemen and ladies, you are welcome.
Thank you.
I think anyway, you are shining. You are shining.
Yes.
That is good. It's happy. It's very, very good that we are all entering into this festive season, and we also pray that 2026 will be our share. And so we have to talk about how we're going to prevent ourselves from certain diseases. So let me start from you, Chandi. You being the guy, normally we say ladies first, but tonight is men first. So NCDs and STIs, why is it important to talk about these two during this festive season?
Okay, so when we talk about NCDs, we are talking about non-communicable diseases, okay? So with non-communicable diseases, what we are only saying is that nobody is going to give it to you. You will develop it your own self. So these diseases are diseases that we ourselves, we can manage not to get. We can prevent ourselves from getting it. And in this festive period, this is the period where we are going to be most at risk of getting this kind of non-communicable diseases, okay? So it is very important we talk about it now because most of them are developed through our lifestyle, the way we live, the things we do. So if you not get it today, but you can lay the foundation today and get it tomorrow. So it's very important that whilst we are laying the foundation today, especially this period of festive periods, we should not lay a very bad foundation where we'll reap it tomorrow, okay? So we want to talk about it now so that we'll prevent the future happenings. The same with the communicable ones, that's the sexually transmitted infections, right? This festive periods, a lot of people will come to town, a lot of things will happen. So we want to try our
The Yankee
best.
people will also be coming.
Yes, those from abroad will be
Now,
coming.
one of hair cars also, or that veggie, go for girls also, Baba.
Yes, so a lot of people will be coming to town.
Yeah, sure.
So a lot of things happen, you understand. Some go out, they drink, they feel tipsy, anywhere they are aroused, then they can do all sort of things. So we want to bring the awareness that whilst you are enjoying, whilst you are doing all these kind of things, you are also at risk of developing something tomorrow of which you'll not be proud of which will be bad. So basically, that is why we want to talk about this in this period. That we are
initially I was thinking about the STIs because, like you said, during this festive season, that is common.
Yes.
But the NCDs are uncommon. But what the lifestyle, how you're going to eat, a lot of people are going to eat more.
The NCDs are not like the
STIs.
STIs where we will say that within 2 months, within let's say 21 days, most of the STIs within 21 days you contract it, right? But with the NCDs, the non-communicable disease, it will be over a period of time because it's a combination of lifestyle factors. So that is why it will not, the onset will not be immediate, but then it will become chronic. With time, you develop it. And at that time, it will be difficult for you to trace back to when you started to lay those foundations. I think moving forward, we'll get to understand the particular ones we are talking about and which ones that we all are at risk of.
All right, that is good. So let's see some common unhealthy, behaviors we see during Christmas and other celebrations. What are they?
Okay, thank you. As Chandi was saying, talking about the non-communicable diseases and the sexually transmitted diseases, when he was talking, he spoke about he explained what the sexually transmitted diseases and the non-communicable diseases. So we realize that our lifestyle is one of it. We have some lifestyles that we should be very cautious about it, so that we don't contract these diseases. Some of these lifestyles include sedentary lifestyle, that is sitting down for a long hours, and also less exercise, our eating habit. During festive season, realize that most of the times our diet changes because it's a festive season. We're taking more sweets, more carbs and other things because the junk food increase during this time, which might make you prone to other non-communicable diseases, as well as the sexually transmitted diseases. During this time, due to the festive season, realize that there are a lot of programs. They are traveling in and out. People will be exchanging contact and other things. They might meet somewhere. They will be tipsy and end up having sex without protecting themselves, leading to other sexually transmitted diseases. So when these are some of the things that we will say that during the festive season, it increases a lot. Because looking at Ghana now, the incidence rate for the NCDs and the STIs is on the rise. Especially the NC, the non-communicable diseases. We have about 70 to 75% of people dying out of the non-communicable diseases in Ghana now. So during this festive season, we are here to talk about it so that people will be cautious about their diet and their lifestyle so that they don't get prone to such diseases.
Okay. That's good to hear. Abigail, for those listening or watching who may not, be familiar, what exactly are non-communicable diseases and sexual transmitted diseases in simple terms?
Okay, so when we talk about the non-communicable disease, we are talking about, when we talk about the non-communicable disease, we are talking about diabetes and hypertension. And when we talk about the STIs, we are talking about the HIV, AIDS, syphilis, gonorrhea, and HPV, and hepatitis B. They are all STIs infections.
Hepatitis?
Yes.
B. You said B?
B.
Or you raise up your voice for me. B or C?
B.
B is sexually transmitted disease.
Yes.
Oh, okay.
It's part of the STIs. When you come into contact or having sexual intercourse with someone having hepatitis B, you can get infected.
But when you were mentioning NCDs, you only mentioned 2. hepatitis and diabetes.
And hypertension, diabetes.
Hypertension, diabetes.
Yeah,
These are the two that.
Cardiovascular accident,
Okay.
diseases.
malaria. They are all non-communicable diseases because
Alright.
it cannot be transferred from one person to
Okay.
So
another.
if I should help her, you realize that the non-communicable diseases, they are diseases that are not contracted from one person to the other, but it progresses as time goes on.
Okay.
As Chandi was saying, it's something that you have it. So as you are growing, it progresses. So by the time that you realize that you don't know when you got that disease from, but it is something that starts from stages to stages, and they are not contacted from one person to the other. Like the hypertension she was talking about, the cardiovascular diseases, the diabetes, and etc. Yes, that are in. And the sexually transmitted diseases, they are the diseases that are contacted mainly through sexual acts, such as the HIV, the syphilis, gonorrhea, hepatitis B, and the rest.
On the 2026 screening, one shot and your STI screening, and you see the result.
Yes.
You know, the-
Right after the Christmas.
Yes, the nature
Yeah.
of the STI screening is that a lot of people, even health workers, when they are to do it, there's some kind of fear or self-stigma, where you ask yourself a lot of questions before you go and do it. So sometimes when you're even doing it free, it's difficult to get people consenting to do it. When people hear that you are doing free screening, they will come and ask which
What
one
type?
and which one you are doing. As soon as you mention, then I'm like, okay.
Okay, thank you.
Let me go and come.
But somebody
welcome.
said it will be better for you not to know your status
Then
than to know your status.
And
If you
that's-
don't know your status, you will live
Yes,
longer.
and that
If you
is-
know your status, you
and
will
that
think.
is the reason
And
why
you die early.
we are spreading.
Yes.
We are spreading. Okay.
All this comes into play because normally when you get to know your status, psychologically it will affect you.
Exactly.
But it will be best when you see it early, you can prevent it or you can even cure it. For example, the HPV, the human papilloma virus. Yes. When you do the test in the cervix, the pap smear earlier and you see it, you can be cured. But if you don't do it and you wait till the later stage, it will end up giving you complications that you can't even cure.
Some
it
of these
again.
diseases
Yes.
are,
So-
it's cool too.
Yes.
But
The
the HIV
Oh, with the
is
HIV.
what we're talking about.
No, you
Yes,
see,
this time we have treatment for HIV. You see, as
Very
I hope
effective
that is what
treatment.
my brother was going to say. We have treatment for HIV/AIDS. So this time, when you test and you are positive, you will be on the drugs,
Medication.
which will help you increase your viral load, and you wouldn't have problem again. We have people who have been on the drug for over 30 years, and they are okay.
Okay.
and
they
you
are
see,
working.
The funniest thing is that people think HIV is deadly dangerous, and you see, it's very difficult managing stage 3 of syphilis. That is, it becomes chronic syphilis. When it becomes chronic syphilis, it only means that we can't treat it. We'll only be managing it. And in that sense, the damage it has already caused to your internal, to an extent that you can't, if you are a man, to an extent that you can't even erect, feelings for sex will go away. So imagine as young as, let's say, 32, 36, you have a chronic syphilis. And you know how men, these things are interesting for us. Now you have a wife, you don't have feelings and all these things. So yes, there are a lot of things there with the non-communicable diseases. As I said earlier on, the problem with this festive period is that in festive period, as my sister was saying, most of our food is either sugar, meat, a lot of meat. You go and the family, meat, sugar, meat, oil, all these things.
If you don't eat these things
The
during
consumptions-
this festive,
yeah,
it
you
means you
get
don't
food
have
to eat.
money.
Aside, you don't even have money. With some people like this, when you go home, that is the option. You don't have food to eat. So unless you now go and stir your teaser to eat, if not for the women to finish doing all these delicacies and come and have time for you, no. And even this period, people that are already, let's make it clear. We are giving education to help people prevent themselves from getting it, and those who are already in it to also take the management serious. Okay, so if you are a diabetic, you have medication. You're supposed to continue with your medication, and is this not the time for you to come and say that let me try the sugar for some time, because you are already having a problem with your body using the insulin. So you are adding more sugar, that means excess. And as soon as the festival periods are done, everybody is okay, but you are in the hospital, you are on admission. So you've gone to enjoy, and you are reaping the benefits of the enjoyment. The same thing with the hypertension, reduction of salt intake and oil and all those things. But festival period now, your friends have come from abroad, so you go out, you take all the alcohol, you take all the salt food, you do everything. You not tell them the truth that I am on a DASH diet or something. You not tell them, you just want to enjoy. After that, they are gone and you are on admission.
You just made mention of hypertension, diabetes, this twin.
Yes,
I want you to explain what exactly are they. Briefly explain to us hypertension, diabetes, and why do they always go together?
Together, yes. So when we say hypertension and diabetes, so let me first start with hypertension, right? So hypertension, we are simply saying that the rate at which your heart will have to pump blood to various parts of your body has increased. Okay, so instead of it pumping at a normal rate, okay, due to one or two conditions that you might have developed or one or two defects that you might have developed. So let's pick a tube. I don't know about electricals. So let's pick a 5 centimeters wire. Okay, they have the number of current that passes through it. Okay, then instead of that number of power that passes through it, you decide that you don't have enough money, so you go and buy 2 centimeters or 3 centimeters. So you realize that the load that will be passing through it will be more faster, heavier than it could have passed through the normal. So with some people, they have some medical condition. So that medical condition will let their blood vessels reduce in size. So when it reduces in size, that means that the blood will have to pump faster and harder so that it will push enough blood to pass through and go to various parts of your body, which shouldn't have been so. Okay, when that is happening, then it means that the heart rate will have to increase. So we also have a situation where there will be inability of your body to contain or countenance sodium chloride. Okay, so sodium chloride helps in us to pass sodium chloride salt. It reduces urine output. So instead of your body to take away the urine, the salt is not being used up by the body to its effect. So what happens is that the salt will be blocking the water from coming out, and once it is there, then it is also putting pressure on the kidneys, and that also pressure goes back to the heart to help it to try to make it to pump faster. So we have the normal range, which we are saying that it should be less than 120/90, by 140/90. But in your case, it is beating more than 140/90 per minute. So
I checked mine this morning. It was 138/84.
Yeah, so in some cases we tell you that pre-hypertension. So there are a lot of factors.
No, 128. 128/84.
You are within normal.
128.
Yes. And you see, in this festive period too, let me chip in this one too. There are going to be a lot of stress. And stress is also one precursor to pre-hypertension or developing hypertension. Stress from your pocket. Stress from moving up and down.
Stress from where?
Your pocket, yes. There's pocket stress. That's monetary stress, which will put you through a lot of psychological.
And the stress is probably.
You understand. So this is why we are doing this. So now let me go to the diabetes. The diabetes is simply saying that your body is not able to use up all the sugar that is being produced. Okay. So it can either be that your body produces the sugar and less of the insulin to take it up, or your body does not produce insulin at all. Okay. So that is the differences here. So here we are talking about sugar. Here we are talking about your heart and its performance. Okay. And
why are they twins?
They are twins because when you develop one, you can easily develop the other.
Right.
So one is secondary to the other, and the anatomy of it is also down to the excretion of urine and other things that you are having in it. Because if the urine cannot come out, sugar is being stored also.
Okay.
So if the insulin is not enough to use it all up, that means that we have to help you by giving you excess insulin.
So that is non-communicable diseases. I bet let me come to you. Take us through this HIV, syphilis, and gonorrhea. Explain these common ones, because this is what we know. So explain to us, how are we going to contract them? How does it also work?
With the HIV/AIDS, someone can contract it during sexual intercourse with an infected person without using a barrier method such as condom. So you during this festive season, a lot of people will be visiting other places and having sexual intercourse with multiple partners. So with that one, during sex and the person is having the HIV/AIDS, without using the barrier method, someone can contract the HIV/AIDS very easily. And with the gonorrhea, that one too, we mostly contract it during sexual intercourse. But and the same applies to the syphilis. That one too, someone can contract the disease during sexual intercourse. So pertaining to the syphilis, some of the symptoms, someone having the syphilis, there will be difficulty in urination and painful. During urination, you feel burning sensation during urination and painful.
Is it applied to both male and female?
Both male and female, and sometimes severe abdominal pain. And pertaining to females, if you're having the syphilis or the gonorrhea, you'll be having during menstruation, and there will be painful menstruations.
So the symptoms of these three are not the same, right?
No,
They are not the same. When there are differences.
Before you go to
Yeah.
the difference, she made mention of during menstruation that it will be painful, and we know a lot of ladies during that period they cry. In fact, some go to hospital and stuff. Does that mean that they have such problems?
No.
Okay.
During with a sexually transmitted disease, with the females, one of the symptoms is pelvic inflammation diseases, or they get most of the time they get painful sexual intercourse. So during this time when they are having sex, they get painful sexual intercourse. There are differences with the STIs, the gonorrhea, the syphilis, and the HIV. Though they are all gotten through sexually transmitted, or they are all gotten through sex, they have their differences. With the HIV, it attacks the CD4 cells on the T cells, yes, and it attacks the immune system. So HIV, that's why we say it is acquired immunodeficiency syndrome. So it attacks your immune system. So someone with HIV having a strong immune system, you wouldn't see the signs and symptoms early because of a good immune system. But as time goes on, the virus will be attacking the immunity. So the person will be having opportunistic infections. Other infection, anything that is going away, you'll be just contracting them because of the low immunity. When we talk of the gonorrhea also has its own signs and symptoms. You get discharges. Then there are sometimes you get burning sensation during urination, especially in the men. With gonorrhea in the females, sometimes it's a bit difficult for you to detect it earlier on, unlike the males, because males they easily get the burning sensation and the whitest discharge from the urethra. But the females, it's normally occurs within the vagina, so the discharges doesn't come out earlier like that. But they also have discharges, which is very offensive. So when you go to the lab and they are tested, you get to know that this is the condition. Likewise, the syphilis that our brother was saying. With a syphilis, you have the stages in the syphilis. Sometimes others start in different. Some start with a papilloma
Virus.
It starts with a papilloma, yes,
Papules.
a papule. with the syphilis. So as time goes on, it also increases. But if you don't treat it earlier on and it gets to the end stage, it becomes chronic sometimes, and treatment is very difficult. So with the syphilis, we always very careful with it, especially with the females. When you have syphilis and during delivery or pregnancy, you might get babies who are blind. Can even lead to blindness to babies. So with the syphilis, that is how dangerous that one too can come. So the signs and symptoms of the syphilis, as you were asking, some also get discharges. They have the same discharges. You get the painful sexual intercourse during. Then you get pelvic inflammation diseases as well with the syphilis. So all these things can be prevented by condom use. The only difference is that with the gonorrhea and the syphilis, they are bacterial infections, but with the HIV, it's a viral infection. So with the gonorrhea and the syphilis, that one you can treat it, or let's say you can cure it off. But with the HIV, you can treat it, but you can't cure it. The HIV is virus.
What is the difference between viral infection and bacteria?
With a viral infection, you can't treat it because if you know, you can't cure it. Sorry, because when you look at the characteristics of the virus, it replicates in the human body. So when it gets into the human body, it replicates. But when it gets outside, it acts as a non-living thing. But within the membrane, it acts as a living thing. So it changes like this. So it doesn't have a cure. It can be off, it can be on. But with the bacterial infection, when you get to the lab and you know the type of bacteria, or you grow the bacteria, you get to know it. That one, we have antibiotics there that can cure that diseases.
So are the early warning signs of all those diseases, obvious? Is it something obvious? They are early warning signs.
Not all, as I was saying. If you have a good immunity, it will be very. It's not obvious. As time goes on, you will see it. That is why we always encourage that you need to come and do the testing. With the HIV, sometimes it's very obvious. You will know through the signs and symptoms that you'll be getting. Yes, such as diarrhea, headache, fatigue, vomiting. And HIV signs and symptoms comes in different way, very dynamic, to the extent that you might be there and be treating for malaria. You might be there and be treating for, let's say, diarrhea, but not knowing it is that
HIV.
You will be treating for mumps. You might think that it is boils, but it is HIV. That is why this time it is part of the health care. When you get to the hospital, doctors require that you go and do the HIV test for them to know.
Do they tell you before you do it, or they add?
It's part. Now the protocol is that wherever you pass to enter the hospital, you must be tested for HIV. So whether through the emergency, through the OPD, wherever.
No, go for your hospital,
But let me add this one. This festival period, we are hammering on this because with the STIs, the STIs is what somebody can give to the other. Human being give it to human beings, okay. But this festive period, I won't just meet you today and I'll tell you that I have HIV, I have gono, I have this.
Possible.
It's something that we live with, we don't tell others. And that is the more reason why you should be careful this festive period. That's why you should use condom. If you want to enjoy it, nobody's saying don't do it if you can't abstain. But also remember, this person you are meeting for the first time, I don't know this person. So you use your condom so that any sickness the person is having, the person will not give it to you. Okay? But as my sister was saying, you realize that when she mentioned hepatitis B, you were a bit surprised. It's because hepatitis B is contracted key in two ways: sweat and then saliva.
And that's into, okay.
Yes, once you are going to have sex, there are the things you are going to add to spice up. Okay? So you have to be very careful too. So you might use your condom all right and still come out with hepatitis B. But good thing is that with hepatitis B, you can prevent it by taking the vaccination. Then you can be rest assured that you won't get it. Even if you take the vaccine and it happens that you get it in a milder stage.
And it can be treated.
It will go by itself.
Yes.
Oh, okay. Okay.
Yes. So we are entreating that in this period of Christmas, New Year, let's try our possible best to abstain from sex, especially
Abstain.
our possible best,
Okay.
especially when we are enjoying going for our clubbing, all our programs. Okay. And if we are to do it, I'll encourage men, women. If the women, a lady, you are going out, you can buy a condom and put in your bag. There's nothing wrong with that. A man, if you are going out, you can buy a condom and put in your pocket.
Are we not encouraging that?
You see, it's not like you are encouraging it. It's something that people will definitely do. So you have to guide them to do it well so that they will not come out with any unwanted situations. Look, at Interbetin, sometimes, mostly after festivals, that is when we record most teenage pregnancies. Mostly after festivals, we record incomplete abortion cases. It's an indication that a lot of people they've not planned for things and they get it. And now some of them too, because if they get this gonorrhea, syphilis, most of them don't come to the hospital now. They find their own ways of treating it. It's only in complicated situations they come. Most of them too, they will not come down, I'm coming to test for this. It's only when it's in extreme. Before a guy will come and tell you that, bro, I'm not laughing there, it means that the penis is itching him. As for the discharge, mostly they will see it, but they won't mind.
Yes, so.
But when the sore start coming on the tip of the penis, then the itching, that's when they will run to you. The women too, the same thing. So it means that they didn't plan and they got it. So we can't tell them, don't do it. We are not encouraging you to go and do it, but we are only saying that prepare and do it well. So this festive period, that is what we are preaching.
Can someone have this disease without knowing it?
Yes, a lot of people have the disease.
So they are
without
symptomatic.
They're asymptomatic. Yeah, asymptomatic. A lot of people have the disease without knowing that they have these diseases. That is why we encourage you to go to the lab and do the testing so that you will know whether you have it or you don't. If you have it, we do have doctors, specialists there who take care of you.
Chani, you explain the causes of high blood pressure.
Yeah.
I want you to tell us what lifestyle worsen it.
Yeah, so lifestyle that worsen it. It means that we have lifestyle that will bring it, lifestyle that will worsen it, okay? So with hypertension, for instance, we say alcohol is one. Alcohol is one. Then smoking is also one. The reason being that, as I explained earlier, most of these hypertensives are having issues with the size of their blood vessels also, okay? And we talk about those we can help to prevent. When you take alcohol, it leaves deposits of itself into the blood vessels, okay? So once the deposits are left there, accumulate over time, the blood vessels, the size becomes smaller. And with the smoking, we have something we call nicotine inside this one. It does similar to it. Some also goes directly to the heart. To also, the heart is like an engine. So when you have an unwanted dust or something accumulating around the engine, it only helps to spoil the engine well. Then with that one too, we also encourage that you do lots of exercises. So sedentary life can also let you get hypertension, because when you are growing unwanted fat in your body, this fat can also have lot of pressure on the blood vessels. Once they're having pressure on the blood vessels, the space that are in the blood vessels will be reducing. So we are saying that sedentary lifestyles, so at least Nowadays, I'm happy that early in the morning on Saturdays, you see a lot of people walking and doing all these exercises, because that means they are understanding that non-communicable diseases are killing. We have most people, their friends have died not because of anything. When they go and do, they'll say, so the person didn't know that the person was hypertensive, so he didn't take precautions. If you are hypertensive, the best thing, number one, you don't have to forget is your medication. You have to be on your medication. The second thing is that try your possible best to exercise. We are not talking about strenuous exercises. Just do exercises, okay? Then also reduce intake of salt and salty products, carbonated products. All these things, if you are hypertensive, you have to reduce consumption of all these things. Once you don't reduce consumption of all this and you increase the consumption, that means you are increasing the risk of developing either a cardiovascular disease, which is CVA, in normal terms, stroke, or you are increasing the risk of death. You understand? You are increasing risk of death, or you are increasing risk of the brother of hypertension, diabetes, or even heart attack.
All right.
To add a little to it, you realize that the food that we eat, most of our food that we eat is either carbohydrates or sugar. The end product of carbohydrate will be sugar. Excess will be stored as fat. Sugar is the end product will be fat. So all these fats end up lining in the lumen. When it lines like that, it thickens it. That was what my brother was trying to say. So the blood flow will have it difficult to flow through the lumen. So when it happens like that, you need to exercise. You need to have a good diet so that it will at least try to break down the fatty molecules in the body. So to reduce some of these diseases, we encourage exercising, like what he was saying. So when you exercise, you burn down the fat, then the body gets enough space for the blood to flow, reducing the risk of cardiovascular diseases, stroke, as we were trying to say.
All right, we still talking about this NCDs, that is non-communicable diseases and sexually transmitted diseases here, and I'll go for a break. When we return, we'll continue. Stay with us.
Since time immemorial, God has always communicated himself and his will through various voices: the prophets, the kings, the judges, not forgetting John the Baptist, who was a precursor to Jesus Christ and gave us the will of God. We bring to you Voices from the Valley. This is a program designed by the Conventual Franciscan Friars in Ghana in collaboration with Cafdil TV to bring you in-depth insight in our faith, catechesis, and various Catholic teachings which will help you in your journey as a pilgrim. I know you cannot miss this program, and I highly encourage you that you shouldn't miss this program, because it is Voices of God from the valley of prayer and silence. Join us this and every Sunday at 3 p.m. and a repeat on Wednesday at 7:30 p.m. here on Cafdil TV and on our various social media platforms: YouTube, Cafdil EDU, and Facebook, Cafdil Cape Coast. Let us meet and share what God has for us through the Voices from the Valley.
Make me a means of your peace.
Welcome back. If you just join us, this is Cafdil Healthcare on Cafdil Television, and we are discussing NCDs, that is non-communicable diseases, and STIs. what are the major risk factors for diabetes, especially this day that our eating habits is going to change?
Some of the risk factors for diabetes is the intake of sugary foods and less exercise and less intake of water, taking in of junk food. Realize that all these things end up increasing our glucose level in the body, which will lead to diabetes. With someone having diabetes, it's either beginning, as Chandi explains, it's either the insulin cannot produce so that it will dilute the sugar, or there is none at all. So during this festive season, you take in a lot of junk food, that is the pizzas, the spring rolls, the cakes, the chips and other things. It will end up giving you sugar, because I earlier on said that end product of all these things are glucose, which will increase the glucose level in the body. So these are some of the risk factors. If we don't try to limit it, it can lead us to such diseases. That is why we said that if I should bring the hypertension back again, they work together, because as the fatty increases in the system, it will, that means the sugar is also increasing. So it will lead to diabetes, making you a diabetic. But even with the meats and other things, we should look at the less fatty meat, or the one that doesn't have the oil being coagulated. We have some meat which is good, that can like the white meat.
Like what?
Like the white meat.
What are the white meat?
Like the pork, the chicken. Even chicken, the back of the chicken has some fat. Yes.
Oh, okay. So
it's a
pork.
white meat, which is also
Chicken.
good for the body. Yes, chicken.
Yeah,
but too much of everything is bad.
But at least pork and chicken.
Yeah,
is good.
unlike the red meat, which has a high level of
Yeah, so even with
fat
the red meat, we always
inside.
advise that you smoke it. Okay?
Yes.
And use it to cook. So let's assume that boys want to do a meeting, they want to do fufu party, okay? Then they want to use, let's say, goat to do it. Ideally, the advised situation is that when you do, you can first smoke it. You will have to first smoke it for some time before you now cut it to use it and cook.
And so one way was smoke no
that one is the skin.
That's
just that to remove the skin. But
talking about reducing the
oil intake.
And once you smoke it, all the oil will go out. Then you cut it nicely and still use it to cook. So let me add this thing. We are saying all these things because we are targeting at least those of us that are grown. Okay, those of us that are old. You know, age comes with reduction in cell functioning. So as we are growing, the ability of our cells to function to the maximum reduces. So you can take an example, buying a new car. Once you continuously use the car, at a point in time, the engine, it can go, but it won't reach where you want it to reach. That's how the human cells are programmed to be. So we have the programs theories of the cells, which are saying that the more you use the cells, the more it is wearing and tearing. Okay, so in the houses in this Christmas, in this festive period, what the children would take shouldn't be what we, the parents, should also concentrate in taking, because at the end of the day, our cells and the children's cells are not functioning at the same level. Because with ours, as we were talking about this hypertension and diabetes, at your level, the production of insulin to take up the sugar is reducing. If it produces, but it's reducing. So if you still flood yourself with a lot of sugars, the excess sugar will be left in your body. And once it is left in your body, it is not going to do anything good, but it's going to do something bad. So we, those that are grown, I'm adding myself, we, those that are grown, we should be able to reduce or discipline ourselves to reduce. So with even the elders like this, you realize that those people that drink, those people that enjoy themselves, they don't actually wait for Christmas to do it. So during Christmas, don't go to the extreme. Stay within your limits. If you are somebody who used to do 2 bottles at a sitting,
Bottle of what?
bottle, anything, a Coke, malt,
Alcohol.
at a sitting, you used to do 2 at your normal sitting. Don't say it's Christmas, I'm doing 6, I'm doing 8. Remember, you are growing. Your immune system has worked hard for you for 60 years. Now it is wearing down, it is tearing up. So let's also look at that. We can't eat as our children want to eat. Yes, and even with the children, we have children that are developing hypertension and diabetes. So with our children, our sister said, just do the fruit juice for them. Most of the children won't even take them to the mall. They look at drinks with colors. So as soon as they run to the fridge, they are looking at this fruit juice and they are okay with it. If you prepare it in the house and they will not eat, when you go to Melcom to shop, this year, put it at your budget that you are going to shop juice. You are not going to shop the sugary ones. You are going to shop the natural juice. We have to start training our children how to take natural
for the
juice.
natural juice. Can't you prepare them in the house?
With some of the kids,
a lot of
yes, and that's what I'm saying. With some
watermelon
people,
and stuff out.
with some people, maybe because they are the ones preparing the house, their kids will not take it. So if you even go out, get them the juice. Let's start training our kids now. I know some 1 or 2 people. They told me that earlier this year that they want to stop buying drinks for their children to go to school. So they will be preparing the watermelon juice and pineapple juice so that when the child is going to school, the child will send it. So you are preparing this child to grow up knowing that fruit juice are the best.
Like someone having the hypertension or the diabetes can be transferred from the mother to the child.
That is the genetic.
The genetic factor or the hereditary. So as you being a mother, you can pass on the diabetes from the mother to the child. Or like from generation. Your mother having a diabetes, you the child, you can also have the diabetes, and your father having the hypertensive, you can also become hypertensive.
Yeah, so in that sense, at that young age, you have to. Me, for instance, in my family, there's history of hypertension. So my mother was telling me, if you don't start taking care of yourself now, possibility is that you will develop it in the future. So with families that you know that there are history of hypertension and diabetes in your family, you start at a very young age treating the children to it. At first, when I go home and they cook, I can't eat. I think now I'm okay with it because my father is hypertensive, so salt intake in our house have reduced. So you realize that all my siblings that are in the house right now, they will grow up getting the taste of small or no salt. So it's the treatment. Once you know you have the risks, that risk flows through your family very early.
Check your lifestyle.
You start checking their lifestyle. Let them work on their lifestyle. Tell it to them. In our family, there's hypertension, there's diabetes. So if you go about doing this, your father developed it after 60. You might develop it around 30.
All right. So what can we do to prevent all these conditions?
Okay. So as we are talking about lifestyle, these non-communicable diseases can be prevented through lifestyles. Like what my sister was saying, it can be genetic or it runs through the family. Yes. Sometimes they say that my mom is hypertensive, so I also have. No, it is not like that. It is not like that. You have to you have to know yourself that you are prone to that. So you have to check your lifestyle so that you wouldn't get such conditions. That is why we are trying to prevent it. We are trying to make a clear cut on that to prevent the spread of the diseases, because beginning we thought that was my mother has it, so I also have to get it. But maybe the food that your mother was eating that led her to get that disease, you can prevent it by stopping eating such food so that you wouldn't get that disease. Yes, but small you can get there. It's not easy. It's not easy, but you can get there. So we can prevent it through lifestyle, as we are saying. Then we can also prevent it through regular exercise. We can do regular exercise to prevent us from getting such diseases. And also we can prevent it by doing regular medical checkups. When you do regular medical checkups, you will know whether you are getting there or you are not. As we were saying that this morning you checked your BP. It's very good that you check.
I do check every
yes,
morning.
Yeah, so that you know the progress of your blood pressure. With the sexually transmitted diseases, that one we've said a lot about it. We know that you can prevent it through the use of condom, or the best is to abstain from sex, so that you don't get any.
The best one is what I've
diseases.
Or what I've.
Thank you.
Yeah.
You've chosen
So,
to do. Yes.
So that I mean, when you go to hospital, and no. That one there's
you've abstained from sex.
And the non-communicable, I do check my sugar and stuff.
Sugar and everything. Yeah.
So what is the correct this thing? If you check your figure, your sugar, what is the normal figure that you should get?
3 points.
No,
It
5
depends.
points.
It
It depends.
on whether you've eaten
Or you've not
not
eaten.
If you have not eaten,
The FBS is 3.9 to 5.9.
if you have not eaten, 3 points.
FBS 3.9 to 5.9.
Okay.
And if you have eaten, is 5.9 to 10.
Okay, then I'm within.
Yeah, so let me add up to what they were saying. With the prevention, as we've said, with the non-communicable diseases, I think most of the prevention is individual related and it's lifestyle related. Okay, the things we eat nowadays, I think we can work on it. Okay, we can work on the things we eat and the kind of things we drink. We can work on them, and that is the lifestyle. It's sometimes, some of these NCDs you can get them through some other diseases or other sicknesses, but which in your own domain you can do more of the lifestyle.
All right.
The food we eat, we check the food we eat.
I have so many questions to ask you, but my time will not allow me to do so. So let me take 2 of them and see. You see, drug adherence is so important. With
The reminders, yes.
in the reminders.
Yes,
So take us through that.
Yes,
and I will
what
end.
we are saying is that we've also realized that some people are having these non-communicable diseases. They are on medication, but they are not doing as the medication will want them to do. So we are saying that adherence is in 2 folds. Are you taking the medicine regularly? Are you taking the medicine as you are supposed to take it? So I don't want to talk too much, but in physics, or is it one of them, we have something we call the half-life of a drug or something. So what we are saying is that to some people, you go to the hospital, we'll give you a drug and we'll give you a time to take the drug. Are you taking the drug that time? We expect you to take the drug because it's a 24-hour cycle, and the drug will have to perform its duty 24 hourly. So when we give it to you to take it at 8 o'clock p.m., we expect that every day at 8 o'clock p.m. you take it, so that there will not be a break in the hours where the drug is supposed to work. It will be a continuous thing. And if we say that take the drug every day, don't go and take the drug today, tomorrow you not take, tomorrow next you take. So you are doing like +1 -1. You are taking the medication, but the medication is not working effectively as it's supposed to work. And we are saying that when you come to the hospital, we could have given you 10 years medication stock to go and put in the house and take. But we still want to monitor the progress of the condition. So we've given you a drug and we say that every month come for review. We are saying that also make sure you come for that review. Because whenever you come for the review, we are able to know whether the drug is working perfectly or not. If it's not working perfectly, we quickly change for you. If it's working perfectly, we maintain and we keep monitoring you. So we are saying that if you are somebody, the drug you easily forget, you can set reminders. We have various kind of reminders, either phone reminder, or we say that put the drug at where you can easily see it, somewhere you go within the house, somewhere you visit regularly. So if it is your dining table, let the drug be on your dining table. As soon as you only eat at your dining table, as soon as you go there to eat, you remember that I'm to take a drug, you take it. If it is your bedside wardrobe, the small bedside wardrobe, or they call it, you put it there. Anytime you are going to bed, once you sit on your bed, once you see it, you will take it. So we are saying that Yes, if you don't have it, fine. If you also have it, we want to prolong your life. We want you to live longer. So if you are taking the medication and you take it regularly, visit the hospital regularly, and do as the drug wants. Some of the drugs don't like alcohol, some don't like drinking, smoking. Some people are there, they can even use alcohol to take the medication. In that sense, you are taking the medication, but will it work effectively? No. That at the end of the day, you blame that the hospital drugs are not helping you. But ask yourself, are you taking it the way you have to take it? So that is what we are saying. If you are a diabetic, you are aware your drug is supporting your insulin to take up the sugar. Once the sugar goes up, you can easily get a brain damage. You can easily collapse, leading to death. You can easily get stroke because large amount of glucose in the brain is going to cause the cells to die. If you are hypertensive and you are on medication and you are not taking it, when the BP goes up, the first sign you get is headache. It means that there's a lot of blood being sent to your head. Once the blood vessels in your head, they break and enters any other place, stroke. So once you have it, take the medication as it is required, and you are going to be fine.
All right. So our time is up. So we are going. What message do you have for our viewers?
Sure. What I would say is that we are pleading with you that you check your diet and your lifestyles to reduce the spread of non-communicable disease and the sexually transmitted diseases.
Any sexual activity with someone, you have to try your possible best to use the condom or using the barrier method, and also avoiding any multiple partners.
Boys supposed to use, or the girls? Do you have
Both.
girls
We
female
have the
condom?
female condom and we have the male condom.
Oh, okay. So if one decide not to use,
The other person should use it.
you should. Okay. But all these things, do health insurance cover them?
The treatment or
The treatment.
Yeah, so with the STIs, yes, HIV is free, treatment is free. With the gonorrhea and co, HIV will cover the medication, health insurance will cover the medication.
All the medication.
Yes, and with the non-communicable diseases, now we even have Mama Cares, which is solely into non-communicable.
Is it
diseases.
effective now?
Well, they've launched it, so we hope they've started.
Oh, okay.
Aside that, with their medications, it's also free. The DM, the diabetic and hypertension medications are also free.
So Abigail is saying if it is not on, it is not in. That's what your point, isn't it?
Yes,
Okay.
if it's not.
All right. So
Yes,
we are going.
yes, I would like to tell the viewers that let's celebrate healthy. Let's lay a very good foundation of which we can reap very good after the celebration. Whatever we are doing this celebration period, this festive period, we should put at the back of our mind that we are going to reap the results after the festive period. So if you lay good foundations now, you reap good foundations tomorrow.
All right.
If you do the bad one too, bad one. So
Certainly.
let's celebrate healthy.
Garbage in, garbage out.
Yes, let's celebrate healthy and have our lives.
Ifwa, thank you for coming. Abigail, thank you. Chandy, thank you. And thanks for watching. You heard Chandy, Ephraim, Abigail, Adams, Sifi, and Ifwa, and they are all public health nurses from Cape Coast Teaching Hospital. My name is Kojo Arthur. Thanks for watching. Thank you to all the crew. Same time next week. Good night.
Nå kvar mye katlika sorba, må mi Jesi ho. Megye nå kvar fama asar, og som arameu. Mojo